right, so the patient who comes in who's delivered in the field, and now your job is to manage the uterus, the placenta, and any PPH that might occur. In this case, we've experienced a lot of blood loss. She comes in and she's bleeding. So how are you going to approach that? Well, the first thing you're going to do is the placenta in or out? If the placenta is in, you're going to deliver the placenta. In this case, the placenta is out. If you have the opportunity to look at the placenta, you're going to look at the back of it very quickly and see if you see any aspect of it that might be missing. Like in this one, missing what looks like the tops of a tree if you're looking down. So first thing you want to do is take a look at the bleeding, get mom positioned, get your hand in there, and feel for the top of the uterus. Is the top of the uterus soft or firm? If it's soft, you're probably having some atony, and you want to rub from the outside, pressure down, and from the inside, fingers in the lower uterine segment with kind of a combing motion in the lower uterine segment. When doing that, you're going to feel for any chunks of retained placenta. So in this case, I've got one here. Nice massage. That's going to take care of 90% of your atony. This should feel like a grapefruit on top, and the inside, when it's free of any clots or debris or pieces of the placenta, should feel like the inside of your cheek underneath your fingers. If that's how it feels, nice and firm, and the bleeding is still gushing out, you want to inspect for any lacerations or other issues. If the uterus is firm, atony is not your problem. If the uterus is soft, atony is your problem. If you think you have atony, you want to start with PPH medications or postpartum hemorrhage medications. First one of these is Pitocin, 1 ampule in the thigh, or if she has an IV, 1 amp in a bag of saline that's running wide open. There's really no contraindications to Pitocin other than a mom who's in florid CHF or pulmonary overload. The other thing you want to give is misoprostol. There are no contraindications to misoprostol. The dose is 800 micrograms right in the rectum, and that 4 pills right in the rectum. The other 2 medications you can give are Hemabate and Methergin. Methergin, the dose is 0.2. It's given IM only, not IV. You can also be giving this while you're doing massage, while you're ordering blood, while you're doing fluid resuscitation. It's given IM again, not IV. IV, it can cause severe hypertension and cardiac events. You don't want to give it to anyone who's already hypertensive. Again, 0.2 IM. Hemabate is 250 micrograms, also IM, but it's an alpha-2 alpha agonist, and you can't give it to anyone with asthma. So your best 2 options are Pitocin and misoprostol, because there are no contraindications and they both work very quickly. If you've got that, your atony's cleared up, now you want to look for any lacerations. So you're going to look at the bottom. Here we've got a small laceration here, a small periclitoral laceration here. If those are really extensively bleeding and you think they're beyond what you can repair, you can put pressure on it just like any other source of bleeding, try to control it that way. You want to look up inside and see if you have any cervical or vaginal lacerations. The easiest way to do that is to push the whole walls of the vagina aside and have an assistant or yourself with another hand grab the cervix with a ring forceps and walk all the way around the cervix using 2 ring forceps to check for lacerations.